Rosario Bacani, 77 years old. I'm here at CSA Medical Aesthetics. I was here last month for a non-surgical procedure to uplift my eyebrow and my cheek. Okay, so I'm back here again for an additional enhancement of my face.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a follow-up. Let's welcome back Ma'am Rose. Hi, Ma'am Rose.
Yeah. Good afternoon.
Yeah. Like about 5 weeks ago, we did a treatment for Ma'am Rose, and these were the PDO threads. We also presented the new one, the so-called N-flip type of threads. And for this episode, we just wanted again another treatment just to do the so-called periorbital rejuvenation. Because last time, Ma'am Rose, her main concern talaga po was the eye area. Remember po, Ma'am Rose?
Yes.
Yeah. Her concern was the hooded eye, the upper eyelid droopiness, or that saggy upper eyelid, or yung we call it in our term upper eyelid ptosis. So for now, Ma'am Rose, so looking at the surrounding eye area region, if you're gonna be assessing po, so we notice already the skin is already loose here in the surrounding or the periorbital region. And then I was also checking on her temple, there's this volume loss or hollowness. Yan po. Na-notice yun rin po yun, Ma'am Rose,
yeah.
Right? Mm-hmm. So over time, like, there is decrease in collagen, decrease in elastin, decrease in those tissue connective matrix. So our skin will become loose, and then you begin to notice sagginess, droopiness. And then also below the eye region, even the puffiness po, no? So the lower part, the infraorbital region, there's puffiness of the skin, or they call it eye bag. And even this part here, like a malar mound here. So these are the surrounding structures around the eye area which we want to correct or we want to improve. And considering Ma'am Rose is 77, so of course we wanted the procedure non-surgical for her and still gonna give a natural result, something still realistic po, right?
Right,
yeah.
Thank you.
So last time we did more of the lifting for the brow area here. We did more of the forehead region. So for today, we can do like the lateral aspect, more of the temple lift here. And then also, we did a mid-face N-flip method here and N-flip method there. Pero let's ask Ma'am Rose, after the treatment po, how was the experience, or after, or the day after you got your treatment, what was the feeling, or were there like a lot of discomfort, or when did you notice the result of what we have done 5 weeks ago? Yeah, interview. Yes po.
Well, after the procedure,
yeah.
The treatment, I feel that it's look like I'm 77
76, okay.
76 years old.
Yes.
And a lot of my friends notice that I'm going younger. I'm looking younger and younger.
Yeah. Ma'am, we just have a question. Why choose non-surgical method over the surgical procedures? Like for example, yung mga surgical facelift, surgical blepharoplasty, and other kinds of surgery on the face. So why the non-surgical po?
Kasi yung non-surgical, it's natural after. You can see the effect right away. Unlike yung surgical, may procedure pa yon, tapos may healing process. Then hindi nakikita ang natural. Ng ano, parang makikita mo talaga na may nahiwa, what do you call that?
May scars din
dito
may
scars,
nga, no? Surgical scars. Especially women, when we love to like pull back our hair, no? You'll see the marks from the surgery.
Yes.
The others po, they're afraid of surgery eh. They don't want to have cuts. Yun. The others naman were saying, I don't want to have a long recovery period or long downtime. Or the others don't want the general anesthesia po kasi. So, for ma'am, she really wants a more natural and a realistic outcome. And of course, ano yan eh, yung at this point of time, we want a procedure na lang na as much as possible, minimal lang or like enhancement lang. It's not really altering the anatomy ng mukha. At least we've done a conservative procedure. So, we say it's minimally invasive but somehow still non-surgical, still not aggressive. So for today's episode, what kind of materials are we gonna use? What will be the treatment approach? What will be the method or the technique? We'll show that when CSA Medical Aesthetics returns. And we're back. So we're doing the so-called periorbital rejuvenation. 5 weeks ago, we did already the brow lifting on this aspect of the forehead. For now, we'll be working on the temple area, okay? And before doing the temple section here, you have to make your markings. Draw your temple fusion line. That's gonna be your superior border, okay? Make a line there. And then after that, you mark your lateral orbital rim and palpate for your superior border of the zygoma there. So since your temple is in this aspect, I wanted to correct the hollowness or the volume loss via the so-called filling in or injection of your hyaluronic dermal filler. And when you want to inject your dermal filler, you have to make sure you are in the right anatomical section. So for this part, for Ma'am Rose, so we wanted also lifting of the upper eyelid region. My safe section here will be this square area here, lateral to the fusion line, 1 cm, and then also superior to the orbital rim, 1 cm. So for our doctors, this is our safe injection zone. So before you do your injection, you have to disinfect the area. Now I'll be using a high G prime type of a hyaluronic filler. So for this section, we have to avoid sentinel veins. So Ma'am Rose, I have a needle here and I'm just gonna be injecting into this area. Inhale, exhale po, Ma'am Rose. You're okay?
Yeah.
Okay. So I need to reach the so-called supraperiosteal plane and I'm already in that plane. And then before infusing your material, you have to do an aspiration there. And then we'll be injecting about half syringe. Okay. So for our dermal filler here, as we always say, do your injection slowly and fill it in with like minimal amount only. Okay. So far so good po, Ma'am Rose. Yeah. So the goal here is to volumize your temple area. So we're doing the so-called needle method approach. And another approach for this one is via the cannula. So the cannula method is spreading your filler material in a superficial plane. And in that plane, you also have to avoid superficial temporal artery. Sorry, Ma'am Rose, we are anatomically based. We want to make sure that we know where we inject your material for safety reasons. Okay lang po, Ma'am Rose?
Okay.
So, no sensation po na pain or discomfort?
Wala naman pain.
Okay. In choosing the kind of filler to inject in this part, you have to make sure that you have the right kind of product po. So for our patients with, like for example, they have thinner skin, you can use like thinner filler, but for those with like thicker tissues, you can make use of your thicker filler also. So far so good po, no ma'am? So we've done a filler injection in this part of the temple. Now the next thing that I'm gonna do is the so-called cog lifting. Now for cog lifting, I can make use of my spiral cog. My entry point will be this lateral orbital rim. I'll be doing like injection of a lidocaine for my 3 entry points here. 1, 2, and 3. So in the past, we've been doing this, and we also inject lidocaine in the path of our cog threads. And I'm gonna be inserting or injecting some of my lidocaine there. So far, so good po, ma'am. So we'll be using 3 spiral cogs with 60mm length. And this will help in pulling the skin towards the hairline region. So the hairline region is the posterior aspect of this temple area. Okay. So we'll have an entry point here. 3 entry points there. 1, 2. So again, the goal is to lift the saggy upper eyelid. Okay po? And we'll be inserting this 60mm cog thread here and then inject towards the hairline. So there should be a give here. Okay lang si ma'am. So sometimes you have some resistance there because some of our tissues are already adhered. Superficial tissues are adhered to the deeper tissues po na ma'am. Okay lang po. So gliding. So once you reach the hairline region, you can actually pull the strand of your thread. And then second one, so this one is smoother, and pull out. And a third one. Okay pa po si Ma'am Rose. Okay. And then after this, after doing the temple lifting, we can proceed to the infraorbital thread insertions. So we have used 3 spiral cog threads, 60mm. So we will now cut these strands here using our iris scissor. And then we're just gonna be pressing on this one here and pressing on that one there. And then after your temple cog thread lift, we can also improve the under eye region using our threads here. I'll be using a so-called scaffold. Entry point will be lateral to the lateral canthus, or temporal to the lateral canthus. So this is going to be my entry point, and I anesthetize the entry point making use of my gauge. This is gauge 18 needle. I'll use a gauge 21 needle. So entry point here using a gauge 21 puncture needle here. And then I have a scaffold and scaffold thread here. These are braided types of threads that are these are very good in volumizing our skin tissues, restoring any lost volume there. So I'll be just correcting the tear trough region as well as the orbital retaining ligament weakening at this part here. So we have to direct the entire cannula towards the tear trough ligament there. So now we have inserted it. That's a subdermal plane, pulling it out, and another one. So after this, we'll be using the so-called Derma spring type of under eye PDO threads. So this is just a panning method. Okay. So inserting the second scaffold thread and then pulling out. Okay. So next one is to inject a lidocaine inferior to the lateral canthus. So we'll be just using single entry point there and then another entry point here, and I'll be using Derma spring under eye threads with 40mm. Okay. So this one is a 50mm type. We have 2 kinds, one with 40mm and this one is a 50mm. And then just glide it subdermally or in the subcutaneous plane. And then once you reach the medial canthal region there, you can pull it out. So another one there. So I can use about 5 pieces of this one on this side of the under eye region. So this is a fanning method again, and then we're gonna pull out Again, another one. So this is the third one already. So we're doing a periorbital rejuvenation, making use of our PDO threads to improve the skin laxity and also stimulate collagen formation as well as elastin formation. Ma'am Rose, you're still okay?
Yeah.
Okay, pulling out. And then second to the last one. So we're gonna do a fanning technique here. We wanted to improve the strength of the skin tissue under the eye. PDO is also known for its lipolytic effect, so any excess orbital fat pads there will be dissolved by our PDO threads. And this will take like about 3 months to 6 months that you further see the improvement in the under eye tissues. Okay, so this is the final thread. Ma'am Rose is still okay. So expect some resistance there. And then we're in the final Derma spring. And we have done the right side. We'll proceed to the left. So we're proceeding to the left side. So again, we wanted to restore volume on the temple. We'll be using our hyaluronic dermal filler. So palpating for the temple fusion line, 1 cm lateral to that, and your superior orbital rim 1 cm superior to that, then that will be our entry point injection. So inhale, exhale lang po, Ma'am Rose. And we are already on the periosteal plane. We can do an aspiration and then push like half mil. So slowly pushing the product material into this part here. So I'm actually palpating this posterior aspect of the temple. I can actually feel for the pulsation of our superficial temporal artery. Whenever we're doing our filler injections, we have to avoid these vital arteries. As long as we are in the right anatomical layer and we are injecting our product material in the right anatomical plane, then we are in a safe zone. You're okay lang po, Ma'am Rose?
Okay.
So pushing a little bit. I noticed that the right temple is much more sunken as compared to the left side. So we always have the so-called asymmetry of the face. One side can be more hollow than the other side. And we are already pushing a little bit, slowly, gently. This one has the benefit also of lifting the lateral brow and the lateral upper eyelid. So it's gonna prevent the droopiness of these soft tissues here. So we're done with that, and then immediately after, we can proceed with the cog thread lifting. So we are pulling the lateral aspect here, the tail of the brow, the lateral canthal region. So entry point will be this part here. So we can anesthetize our entry point here. So injecting our lidocaine with epi. Expect some pinpoint bleed. And then we can inject our lidocaine in the track of our cog thread here. So we are in the temple section here. So the temple region is also giving like a lifting benefit for the lateral canthal as well as the mid face section and even the lower third of the face. Once you improve the temple, it's like also pulling the mid face and lower face part of it, and it's gonna give that rejuvenated look, improving the periorbital region. So the goal here is periorbital rejuvenation, right, Ma'am Rose? Kasi Ma'am Rose also wanted to have like a widely open eyes or like lifted upper eyelid. Na, Ma'am Rose?
Yes.
Why not like enhance the surrounding eye region? Okay, so we have already anesthetized the area. So entry point here, I'll make 3 puncture point there. So some are maybe wondering, like Ma'am Rose is in her, like she's 70s, right, Ma'am Rose? 77. So she is so healthy. And actually, I should say she's not a bleeder. We just have the expected pinpoint bleed. Of course, whenever you do puncturing with a needle, you have some pinpoint bleed there. But Ma'am Rose is so far so good. She's doing well. So we have to really reach that hairline region there, we have to anchor our cog in the upper section here to really have that good lifting benefit there. And then second cog, so entry point there. You can actually do a mix or a combination type of pulling. You can also do your entry points in the hairline region. You can do your entry points in the tail of the brow and the lateral canthal region. And that will give a much more stronger lifting benefit when you do your temple lift. So this is part of the periorbital rejuvenation. So filler injection also, we did a while ago needle method. You can also do the cannula method for this part here. So there you go. So once we're done, we can already cut the strands that are extruding from our entry points. So use an iris scissor at this part here. So if there's some bleeding there, just direct pressure. So we'll be proceeding to the infraorbital section. So for that part here, I'll make an entry point for my end scaffold threads, the braided type of threads, to volumize the infraorbital section to improve your tear trough as well as your palpebromalar groove. So I have a gauge 21 needle here, making my entry point and then inserting my first end scaffold there. So just inserting perpendicularly and then gliding it towards the lower orbital rim, okay, towards that tear trough section there. So Ma'am Rose has a very high tolerance. And then pulling out, and second end scaffold here. Then after the scaffold, we can proceed to our Derma spring under IPDO threads. Okay. These are kinds of volumizing threads as well, and they're also stimulating collagen synthesis, elastin production, and they will improve the tissue matrix, skin matrix, strengthening and tightening our skin. So our Derma spring threads. So I'm actually using the one with a 50mm length, and I made an entry point there, and we can like make another insertion of our entry point. There we go, and insert this Derma spring there. So initially you can go perpendicular and then just glide it towards that medial aspect there. Entire length of the cannula should be inserted. Okay, some of the PDO under eye threads, they make use of a needle, but this type is a cannula type. So if you have a cannula type, you need to make an insertion point. So over time, our skin loses its collagen, its elastin, all those fibrous network, and you wanted to restore them. So you can make use of these kinds of treatments to again stimulate your fibroblasts to make your new collagen and your new elastin. So inserting entirely in my port. Okay. So it's a fanning method here. So strengthening your skin structure. You can insert this subdermally. So just directing towards that tear trough section there. And a final one. So we have done basically combination filler and threads for periorbital rejuvenation. We've made use of spiral cog threads, end scaffold, Derma spring threads, and even our hyaluronic filler. We'll show the result when CSA Medical Aesthetics return. And we're back, so we'll now show the result to Ma'am Rose. Ma'am Rose, here's our mirror. Ayan po. And you can check on the outcome of what we've done. A combination filler and threads for the periorbital rejuvenation. The approach was correcting the temple hollowness via injecting filler and also doing the cog lifting towards the hairline there, and then the under eye region we use threads also, Derma spring and scaffold, to improve the texture, also improve the skin laxity, and we wanted to restore that tighter and firmer skin, and of course a youthful look Okay, somehow give that enhancement in a natural way. Not too much, not drastic, but still some that yung face ni ma'am, still si Ma'am Rose.
Yeah, still the same.
Still her. And it's just like a result that, of course, we want it non-surgical and not too aggressive, and something that Ma'am Rose would love.
Yeah, I love it.
Yes.
I love it. Thank
So,
you.
Ma'am Rose, so far po, how was the experience while we were doing the procedures po? What did you feel?
Well, a little bit of pain,
Yeah.
some parts.
Some parts,
yeah.
especially whenever we inject lidocaine, it's normal to feel parang burning sensation.
Yes.
Others were saying like it's like a stinging sensation. But the rest po, because it's already numb, you don't feel the insertions of the threads.
Right.
Because we were looking at you a while ago, while we were doing the procedure, you were just relaxed. And plus, she has high tolerance to pain. Thank you so much, Ma'am Rose.
Thank you,
We're so
Dr.
happy.
Ann.
Actually, we were able to achieve that lifting already of the upper eyelid. And the eyebrow position is still good. And of course, the temple volume restoration is there. And then the under eye skin was also improved. And over time, with like as weeks and months will pass by, we'll still notice further improvement because the PDO threads will stimulate a lot of like elastin collagen formation as well as new vascular formation there. Thank you, Ma'am Rose.
Thank you, Dr.
There you go. And if you want to also check the episode we've done for Ma'am Rose last time, you can check our YouTube channel, Contessa Salvador, and watch the end flip method that we've done and also the brow lifting that we have done for her. And actually, you can appreciate already that rejuvenated look in a way that it's gonna still be realistic. It's not something exaggerated. And yung the others kasi pag facelift, ayaw kasi ni ma'am yung unnatural look. She just wants something still natural. There you go. So if you have any questions, you may email us at csaskinclinic@yahoo.com. Our clinic is located here at the CSA Infinity Shop, Pulong Maragol, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. We also have our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. Again, please do watch our other videos. We have them in our channel, Contessa Salvador Alapag. And you may also click the subscribe button as well as the notification bell to keep you updated. Thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.